owned and operated solely by registered nurses, all with advanced skills and extensive experience in home health care. Call us at 888-422-3578. Our team of caring professionals include registered nurses, licensed professional nurses, registered physical, speech, and occupational therapists, medical social workers, and certified nursing assistants. Visit our website at elitehomehealth.com. All employees are subject to detailed background and reference checks. Their team-oriented approach ensures an optimal outcome for all of our patients. For more information, call us at 888-422-3578.
Good evening, everybody. Happy Monday. From me, your host, Jackie Birch, in the Elite Home Health Care Show. I am here tonight with Region Quest. I am here with Hope Fine. She is the professional liaison, and Denise Coelho, the clinical director, And we have Zachary Blaisdell from Elite Home Health himself. And we are so excited to give you guys the information tonight on Region Quest and why it stands out in the medical world of South Florida. So Denise, tell me a little bit about yourself, what you do with the company, and how it makes you stand out.
Okay, great. Yeah, thank you for having us, first of all. My name is Denise Coelho. I'm the clinical director and nurse practitioner at Region Quest. We are a freestanding wound care and hyperbaric center located in Deerfield Beach. We specialize in wound care, hyperbaric oxygen therapy, as well as our new program, which is our nutritional program and sports medicine program. So we're pretty excited about that. So we're a freestanding clinic, so that's what separates us from all of the other hospital-based facilities out there.
It's totally up to date, and we were talking a little bit before the show just about the hyperbaric oxygen therapy that you guys provide. I mean, it is so amazing what you guys can really do for wound care. And I'm just curious as what is it exactly? What's the breakdown of it? What is it? How does it help?
Okay, hyperbaric oxygen is a wonderful adjunctive therapy to all other treatments. It's not a standalone treatment. It's best done when done with other treatments. So with your wound care, with your nutrition, with other types of therapies. Hope Fine here, my coworker, she is our liaison, and she's also a certified hyperbaric technician as well as a respiratory therapist. She's been doing this for a long time. So Hope, why don't you answer that?
Well, clinically, hyperbaric oxygen therapy is 100% oxygen under pressure, as if you were scuba diving.
Wow.
And doesn't feel like you're scuba diving. You're in an enclosed acrylic clear chamber. Your body is pressurized, and while you're in there, you're breathing 100% oxygen. So the oxygen is getting down into a cellular level. It's just not in your red blood cells. It's actually going deep into the cell and into the organs.
How long about does it take each patient to sit in this chamber for to see some of the results?
Well, it's subjective,
right,
depending on other comorbidities that the patient may have. But on average, you're looking at probably 40 treatments for a non-healing wound.
Okay. And how long is each treatment? A half hour?
Oh, they're in there about 2 hours.
Okay, wow.
A total of 2 hours.
Okay.
Yeah. It's
That's
very
incredible.
comfortable. The whole bed goes in. They lie there. They watch. We have these big flat screen TVs.
Oh, great.
Yeah, you can see through, you can watch. Yeah, it's
so
good.
it's very comfortable. You
Right.
could sleep if you want.
Yeah, absolutely. The best thing to do is just to make the patient feel comfortable, and it seems like that's a big priority for you guys, which is really amazing. What kind of wounds do you really see, and do you deal with what's challenging, what's easy?
Yeah, we see a variety of wounds. We primarily focus on advanced wound care, which are your skin substitutes and your advanced type of wound care technologies. We see a lot of pressure ulcers, a lot of diabetic foot ulcers. We see some pretty bad skin lacerations. We do see some burns. So we have a variety of wounds. So whatever wound you have, we are capable and willing to help heal you. And just come on down. We will give you a great evaluation, and we will be able to see what type of treatment would be best
Right.
suited. And if you do have a diabetic foot ulcer, insurance companies will recognize hyperbaric oxygen therapy along with the wound care as part of the modality for healing those ulcers.
Wow.
So that's a great thing.
Yeah, so one of the reason we use them. So it's wound care. They specialize in wound care, or at least that's how we've been utilizing them. For our more difficult, like she said, advanced wound care for our more difficult patients.
Right.
For our home health, we utilize their nurses because they have such great experience dealing with these advanced wounds. In addition to that, the hyperbaric, it's giving the cuts more oxygen. So
Right.
patients that get surgeries, for instance, that have, as Hope said, other comorbidities, so like peripheral vascular disease,
Right.
atherosclerosis.
Big word.
Which basically just means not enough. The capillaries struggle to get the oxygen
Right.
all over the body. So patients that suffer from them when they get surgeries or they get injured, they're not healing as quickly
Right,
as
right.
the typical wound care isn't accomplishing the same job as somebody that doesn't have it.
Absolutely.
So giving them over to Region Quest to do the hyperbaric therapy allows
incredible.
those patients to get the extra care to bring them
Definitely.
up to par.
Right.
And as you viewers know, Elite Home Health is the best of the best trained professionals of South Florida, and we only bring on the best of the best trained professionals of South Florida. So thank you, of course, for choosing Elite Home Health. And if you guys have any questions at home or on the road, call in at 888-565-1470. We cannot wait to answer any of the questions. Or if you were watching on Facebook, comment down below and we'll see it up on the screen and we'll get going. So how long have you guys been in business? I read online that it was over 30 years of experience. Is that
Well, I started in the business in the hyperbaric over 20 years ago. Yeah. Originally, and it was we specialized in the hyperbaric, and then RegenQuest acquired me. We merged about 2 years ago.
Oh, great.
Yeah.
Okay. So just all the experience, how do you think that it's helped you specialize to each patient and kind of just make each patient their own within their own care programs and everything? How do you think that that's helped?
Well, I think it's because we are freestanding and a non-hospital based, we are able to make it more personalized. The hospital has a lot of rules because we're freestanding. We have all the certifications. We have to abide by everything that the hospital does, but we can accommodate the patients more personalized in a more personalized way.
You have more flexibility to work with the patients.
Absolutely.
We
more
do.
flexibility.
And then with as far as their disease processes, the insurance companies will only pay for certain diagnoses, maybe about 13 or 14 diagnoses. And the hospital-based facilities cannot do hyperbaric oxygen if it's not paid, if those are not the diagnoses that are paid. But since we are freestanding, the first thing is we are 60% less. Our cost is 60% less than a hospital-based facility because we do not charge a doctor's fee and an overhead hospital fee.
Wow.
So we're considerably less for the patient who pays out of pocket as well as for the patients with copays and insurances, etc. We also do off-label, what's called quote-unquote off-label diagnoses that are not paid for by the insurance.
Non-insurance cover.
Right. So that would be your traumatic brain injuries, which hyperbaric oxygen has been shown to help significantly. That'll be for your wellness patients, for your bone patients, for cancer patients, stroke patients,
plastic surgery,
autism,
plastic surgery,
Really?
near drowning.
That's very interesting.
It's a variety. We're not saying it cures anything, but in conjunction with everything else, it improves a patient's quality of life. So this is a fantastic treatment, hyperbaric oxygen, in conjunction with everything else, and we're a fantastic facility because we are freestanding.
Right. You're not drove down in boards
Right.
on boards on
Yeah.
boards.
Correct.
Of-
In hospital bureaucracy, we're not like that.
Right. And you guys mentioned you're 60% less than the hospitals. Who wants to go to a hospital anyway? You're going to be in the waiting room.
That's
But
right.
for real, you don't want to be
you're
sitting
right.
there and waiting for the doctor and everything. And
That's
hospitals
right.
are so hectic and they're scary and
And the parking
uneasy.
lot.
Oh my god, the
People
parking.
get white coat syndrome. It's
Yes.
a real thing.
Yeah.
Yes.
Real thing.
Yes,
And
it's
what
a real
worse
thing.
place than a hospital to
Can I be
experience that?
completely honest with you? I totally have that. Every time I go into a hospital, I hold my breath and I get weird. But to know that it's a standalone company, it's amazing. It makes it that much more comforting
Yeah.
to know. And then you get
Yes.
to know your doctors, you get to know the patients, and like you
Oh,
said, it's more
yes.
flexible.
Oh, we
Right.
love our
And
patients.
The facility's right off of Hillsborough.
Hillsborough
right?
and
Military
Deerfield.
Trail.
Yeah.
Yeah.
right at the
Hillsborough
border
Military.
of Boca. So
Yeah, yeah.
we're open Mondays through Fridays, 8 to 4:30.
Well, ladies and gentlemen, we do have a call from Beverly. Hello, Beverly.
Hello.
Hi, how are you?
Okay, thanks. Your program is very interesting.
Thank
I was
you.
wondering, have you had any children there for treatment recently?
We've had
Since
many
it's a new-
children. Over the years, we've treated hundreds of children with either autism or cerebral palsy
Wow.
and near drowning as well, but not as many.
Thank God.
What about
Hundreds of
smoke
autistic
inhalation?
That's amazing.
Yeah, yeah. With
Smoke inhalation is primarily a emergent hyperbaric procedure. So you probably would go to the emergency room to a hospital-based facility. Am I right?
for
Hope?
smoke inhalation,
Yeah, there are a few things that are emergent, and we would not accommodate them at our facility due to the patient's best interest.
Okay, and you take all types of insurances?
We take just about all insurance. However,
It's a-
all insurance does not pay for all diagnoses. So
I see.
depending on the diagnoses, it will, determine whether your insurance or not will pay. Yeah.
Okay, thank you so much.
You're welcome.
Thank you, Beverly. Have a wonderful night.
You too, thanks. Bye-bye.
So, with her question about the insurance, you did mention that before, but I think that it's great for our viewers to know that you're not shutting anybody out. You're going
Right.
to take everybody in and you're going to let them know their financial options, their medical options, and the fact that, you're not trying to overcome the hospital. You're still working with the hospital.
Right.
Oh,
With if
yes.
it's an emergency, that's going to be the option.
Oh, yes.
And that's one of the things so great about Elite Home Health. You don't try to cancel each other out.
Right.
We're all working together
Right.
for the patient's benefit, for the better care.
Yes.
Right.
Yes.
When we work as a team,
Right.
that's how
Right.
the patient, we're here for the people that need it.
It's a little cheesy line. There's no I in team.
And the good thing about Elite is that because we can work so closely, we're not a big hospital-based facility, so we're more intimate in our day-to-day operations.
Yes.
So if the home care nurse from Elite needs something, they can call me, the nurse practitioner. I'm there all of the time. Our medical director, Dr. Juan Bravo, he's very internationally known. He oversees everything, and he's on site every Tuesday and whenever we need him. So we're always available to the patients as well as to Elite Home Care.
And that's one of the benefits because,
Right.
as they were saying, as they're not drove down in the bureaucracy of the hospitals, we're able to have that one-on-one feel between
Absolutely.
us and their
Right.
facility as
Right.
well as the patient. It's
Right.
it's everything's open communication and all patient-centered, but it's not as difficult to work
Right.
together.
Right.
And
because-
Denise and I work very closely as well. So if somebody from, Elite should call and she's busy with a patient, I can always answer the question as
It's
well.
amazing.
You know.
And one thing that I want to highlight that all of our viewers know that follow our show, Elite Home Health, is all about communication, transparency, honesty, education of their patients, and we don't bring on guests that go against those. So I just wanted to highlight that. But that's amazing. What are your hours that I can contact you? Do you have an emergency line, or do you just direct me to the hospital if there is a severe emergency late at night?
Yeah, we're there from 8 to 4:30, but
Okay.
that is flexible. If we have to stay later, we'll stay later.
Great.
Depending.
Now, it's by appointment only, correct?
Yes.
Okay. And about how many appointments do you do a day? Do you try to get everybody in?
We try
Do you
to accommodate everybody, and that's another thing with a freestanding that you don't see at the
Right.
hospital. We try to accommodate everybody, and everybody has different schedules, and especially
Absolutely.
like if you have children with autistic
Yeah.
children
Yep.
who have to come after school. Of course, the hospitals wouldn't do the children in the first place,
Right.
but we will try to accommodate them. So if we have to stay a little later, we stay a little later. The hospital
That's
has
incredible.
these strict hours. And, we close at 3:30, and that's it, and we can't see you. But we're not like that. So
I'm extremely interested in the autistic children that you see. What are the why? I guess is my question. I mean, how does it really help them? How does it help their quality of life?
Any neurological problem is a wound in their brain. You have to
Okay.
consider it a
Wow.
wound in their brain. It's just like a wound on their foot. They have a
Yep.
wound in their brain. So the added oxygen and the pressure just starts to heal their brain.
That's
So,
incredible.
Yeah.
Giving everybody a chance. I love
it really
that.
is. It really is. You see a lot of great
And with
things.
the autistic kids, some of them are so small. Babies, sometimes we dive babies, and
That's
things like
incredible that you take all ages.
all ages, and sometimes the mom or the dad has to go into the chamber with the child, so there are allowances for that. So it's not like the parents will
Right.
go in, will send their kid, their baby
Right,
by
right,
themselves.
right.
There's
'Cause that is
enough
something.
room for the baby and the mom or the dad.
And how would it affect the mom or the dad with no wound? Per se,
just
it doesn't.
great.
Just beneficial.
yeah.
Yeah,
I mean,
it's
they're
great.
just getting, extra oxygen.
Extra
you know.
oxygen.
So I have the science background, right? I was
This guy, he is a man of many, many things.
well, I was doing some research about it before, and I think it's really interesting. So the reason it's like 20 to 40 treatments, right? So it has to be repetitive because, we're walking around normal, breathing oxygen, not 100% oxygen.
No, we
No.
only breathe 21%
Yeah.
oxygen in the
That's why I'm
atmosphere.
always out of breath.
Oh my God.
No, but it's so true.
But so the pressure basically, the reason it's pressurized, it pushes more oxygen. So
Okay.
it allows your lungs to inhale
Expand.
more.
Right. Okay.
And the 100% oxygen, the point of the repetitive treatments is because it slowly transitions your body from the normal.
Yep.
Right, because you go in, if you went in for one treatment, that would be on that emergency case, like in the hospital, the
Right,
smoke
right.
inhalation, whatever, carbon monoxide poisoning, what I was looking up. But that's like a one-time fix. Whereas these wound care, to gain full benefit, it's over time because
Absolutely.
you are slowly, progressively increasing the amount of oxygen in the
in your
blood.
body.
Right.
It's like a medication. I always tell the patients, it's like a medication. The more consistent you are, the better
Yeah.
for you.
Right.
It's absolutely amazing, especially talking with you lovely ladies. You guys are so great. Tell people how we can reach you.
Our phone number is 954-571-9392, and we are available Monday through Friday. Our normal business hours are 8 a.m. to 4:30 p.m. We technically don't close for lunch, so you can give us a call. We'll call you back even if you have a question you want answered. We'll sit on the phone. We'll explain everything. We'll even check your insurance before you come in,
That's
just to make
incredible.
sure
Yeah.
you don't waste your time coming to us. We also have consultations with myself or the doctor before each hyperbaric treatment. The wound care, of course, you come in, we'll do wounds, we'll take pictures. That's mandated by the insurance companies.
Absolutely.
And we also have a new nutritional program that
Yes,
we're getting
and that's what I want to get
ground.
into later on.
Okay.
But for right now, we're going to take a quick break.
Sure.
And as she mentioned, time is valuable. So if you're listening right now, why not call us in and ask us your questions? 888-565-1470 or drop a comment down on the Facebook page. We'll be right back.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects. Provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
To understand it.
Welcome back to Elite Home Health. My name is Jackie Birch. I am your host tonight with Region Health and Elite Home Health, of course. Right before the break, we were just talking about the treatments that everybody gets, the ages, the hours, everything. Again, if you do have any questions, feel free to call in at any time. And right now, I'm really interested in the nutritional program. Is this something that's new? What does the plan kind of incorporate?
Yes, the nutritional program was rolled out pretty recently at the end of last year. And we have a registered dietitian and sports nutritionist. Her name is Allison Escalante. She was a personal trainer before she joined us. Before she joined us. So we've devised an entire nutritional program for anyone, for wellness patients, for patients with wounds, just anyone who's interested in increasing and improving their health. Allison is also going to be part of the it's actually an athletic program that combines the nutrition as well as athletic hyperbaric oxygen therapy. So we're getting that off of the ground. Yeah, because hyperbaric oxygen does a lot of good for athletes, which we know some athletes have hyperbaric oxygen
Therapies in their home, right?
in their home, chambers in their home.
Well, I wouldn't call them hyperbaric oxygen chambers because they're not pressurized with oxygen.
All
They're
right, true.
semi-hyperbaric chambers. They don't pressurize very deep, and they're not breathing the 100% oxygen. So it is really quite different. It's not
True.
really a medical modality, but some of the athletes do have them in their
Well,
homes.
anything that you have at home is definitely going to differ from a professional medical background of a place. But that's really incredible. So you're working with athletes as well.
Yes, we've started that program. Allison will be doing some talks, some nutritional classes, showing people how to make different types of healthy food. She creates a meal plan for patients. All of that is on our website, so feel free to check it out. There's different levels to the program.
Now, with her working with each patient, does she do specific plans, or is it just a broad plan where people can pick their meals? Specific. That's great.
Individual plans per person.
That's
If you
great.
cannot come on site to talk with Allison and to do your discussions and your sessions, she can do video chats or Skype or whatever. Yeah,
Wow.
so she's flexible. So wherever you are, she can reach out to you that way as well.
Now, with people that are dealing with the wound care, is this part of the treatment? Or is this a totally separate thing that they're more than welcome to utilize?
They are welcome
Right.
to our diabetics, more than welcome. Anyone is more than welcome. Some are hesitant because I guess they're kind of stuck in their ways with their eating habits. But yes,
They're already trying to be
yes.
healthier on one level.
Yeah,
It's hard.
it's
It's hard to eat like that. But it's so important. And, everything working together just promotes faster recovery and
Absolutely.
True.
better quality of life. So why not?
Why
Right.
not?
And it's there.
Exactly.
That's that full picture.
It's that full
That's
picture.
right.
Yes.
It is part of the education. It's part of the transparency. It's part of the everything that we all stand for here.
Yeah.
Basic
That's right.
human rights.
That's right. We
That's
look
incredible.
we treat the entire person, not just a body part, the entire person. And hyperbaric oxygen is great for athletes because athletes become injured.
Yeah.
We treat many athletes. Yeah.
That was something that Zach and I were talking about before the show even started. I said, "Oh, is this good for, lactic acid buildup?" And it definitely is, especially with athletes pulling muscles and everything and sitting out, and especially with South Florida being such a college area. I mean,
Fitness.
and fitness area.
And concussion, we see a lot of athletes with concussion.
Really?
Very effective. Yeah, well, again,
Again,
it's
yeah.
inflammation in their brain.
Yeah.
So it helps with the inflammation.
Right. Oxygen decreases the inflammation and promotes blood flow, and it helps to repair those really micro tears.
Yeah, that's because from talking about it's the blood, right? It's putting more oxygen in the blood.
Right.
Working out is just repetitive muscle wounds.
Right.
For,
That's perfect.
It's really just you are wounding your muscle.
It's wear and tear.
Right.
Absolutely. And everybody wakes up sore some days.
Right.
And,
Right.
you push it because you think it's a good sore. And
right.
you're going to ignore your
Right.
body depending on your fitness goals or
Right.
everything. But something that I see so much down here is bodybuilding. Do you help a lot of people that are going into bodybuilding competitions with the nutrition plan and everything, or?
We're definitely gearing our program towards that. So that's
Right.
one of the things we would like
Yeah.
to bring to our facility to help athletes, to help anyone, bodybuilders, anyone, basketball players. Hope has had some
Quite
treated
famous
some quite famous
basketball players.
because our chambers are big enough to get those 6'5", 6'7" athletes in there. So yeah.
So there's no excuse. It's comfortable. You have the option to sleep.
Or watch TV.
Or watch
Watch
TV.
TV.
Now
both.
with this, is there a lot of noise when you're in the chamber?
No, all you hear is the television.
That's amazing. So it's not like an MRI where you're laying
Oh, no,
down
no,
and
no,
you
no,
hear
no,
everything with the headphones. Okay, cool.
No, you're not strapped down. We have the large chambers in the industry right now.
Amazing.
And so you're not tied down. You're very comfortable in the bed. You have lots of room to move. You're watching the television. And
Because that was going to lead to my next question. You guys did mention on comfort, and I can be claustrophobic. I remember I had to do an MRI, so that was the immediate thought that was in my mind. Am I going to have to stay still?
Right.
Is it going to be a lot of noise that's going to maybe make children nervous? That's really something special. That just adds on. And these athletes, if your parents are dragging you there, why? They're going to walk out feeling so much better and relaxed because it's so
Yes.
comfortable.
It is
That is so
comfortable.
great. So
Yeah.
what are some of the meal plans that you offer? Is it smoothies or just
I think what Allison does, and she would love to come and talk about this
Absolutely.
at another time, but what she does is she quote unquote interviews a patient
Okay.
or a client at first to see what they like to eat, what their schedule of eating is, how often they eat, etc. She does do their body fat and she does their weight, things like that. And then she individualizes a meal plan for that patient based on what they like to eat, not what she thinks they should eat, but what
Wow.
they like to eat. So that's very important because if you're going to do something long term, it's something needs to
Absolutely.
be something you can live with. So that's what she does. She individualizes the plan towards that person.
and that's one of the biggest mistakes with dieting and trying new meal plans is because you're not used to eating these foods and you don't like these foods.
Right.
And if you're used to having Pop-Tarts for breakfast and you switch to egg whites and it's going to last 2 weeks.
Exactly.
or what happens is they lose a ton of weight, and then as soon as they stop the diet, they gain it all back.
Right.
And more.
Right.
Well, I even read a bunch of stuff on dieting and everything. It's like you do so well, but you're depriving yourself of some of your cravings. You come home and
you
you don't even
gorge.
eat that one chip. You eat the whole bag.
Yeah.
Oh yeah.
And chips aren't good for wound care. I don't know if that.
Really?
It's like
Oh, I'm
little
kidding.
known fact.
Well,
You can still have your chips probably on her diet, but she teaches
Absolutely.
you.
I'm just
And then the good thing with the nutrition that Allison does, and in conjunction with the hyperbaric, is suppose you have inflammation, like the concussion patients or anyone else with inflammation.
This is
So
gonna-
she will
yeah.
do a diet specializing in decreased foods to decrease inflammation.
I was gonna say.
I was just gonna.
Yeah.
Were you? Same
so
right
We
over here?
were interlinking.
a
But
win-win.
food is the best medicine, and there's so much food out there that helps. Now I'm losing the word. Maybe he can get it.
So
You're already reading my
But I was gonna say, because you were talking about medical diets, essentially, right? We have a lot of our patients. So we're a Medicare company, so a lot of our patients are older, and one of the issues, and I'm sure because diabetes patients on two different sides, you coming in for the wound care for regular, diabetic wounds,
Right.
but also dieting, right? Now it's kind of a one-stop shop.
Right.
That is
You got the
it.
hyperbaric.
Right. Because
chamber.
with these diabetic patients, if they don't eat right, their wound is not going to heal.
Yeah.
Absolutely.
You know,
Or if they're newly diagnosed, because as you get older, diabetes is a lot easier to
like
get.
that.
Right.
It's a lot easier to get. So
Yeah.
if you maybe you don't know what you need to change, because
Right, exactly.
doctors will only say so
Definitely.
much. They're not gonna. Unfortunately, I don't know doctors that are sitting down like, let's go over your diet.
Well, that too. And I mean, obviously, there's options online and whatever it is, others dieting programs, but it's not personalized. And you really don't know how a certain diet's going to affect you. It might make you gain weight. It might make you lose too much weight. It might just mess with your sugar levels. You don't know until you sit down with somebody who's going to really help you.
Right.
So, with the combination of these two, plans, modalities, everything that you guys are offering, you're bound to just heal quicker and just to live a better lifestyle.
Yeah, that's
two
our
is better
hope.
than one.
That's our hope for everyone.
That's
Yes.
amazing. That is so amazing. So when I know it's all personalized and everything, do they have the option to meet more than once with the nutritionist a week, or how does that necessarily work? Is it like a one meet and then they're good for a few months? Or
Well, she has different programs, so she'll set up a program with the patient.
that's
They'll
incredible.
discuss it. Yeah.
Yeah.
Oh, great. Okay.
Yeah.
Yeah.
Great. So you see a lot of athletes, you see a lot of people with the wound care. Do you see people that are just trying to lose weight as well with this? or
Overall wellness.
Yeah.
overall wellness?
Just overall wellness, maintain their weight, lose weight, gain weight, whatever it is. Yeah.
Cancer, we see cancer patients, they need to be on a special diet as well, low sugar.
and the wounds
And
associated
the wounds,
with it.
and
Yeah.
the wounds from the cancer, especially if they've had radiation,
Radiation,
to
radiation
a
wounds are
breast or prostate or
pretty
something like that.
severe.
We see
Yeah.
those patients, so we see them in the chamber, and
Right.
of course some of them have wounds, so Denise sees them on that side, and then Allison sees them and does her thing.
That's amazing. You get so many different points of views, and I think that's just something that's comforting. And whether you think it'll work for you or not, when you step into the office and you see everything that you guys are offering and just the familiar face,
Yeah.
I think that's something so huge. Because especially with cancer patients, you're going into the hospital, you're going into these places. Sometimes it's a new doctor, it's a new face, it's somebody just working together. You're not familiar.
Right.
But you ladies are always there.
We're
and
always there. We live there.
It's
But it's
amazing.
great. We get to know our patients
Right.
very well. We're on first name basis with them. They call, they give us updates about themselves. So it's really a special place.
Yeah.
Especially for
the
some- yeah.
the hyperbaric patients are there usually Monday through Friday. They're
Right.
there 5 days a week.
Right.
They could be
Oh,
there for a
wow.
couple of months. They become your family.
Right.
Absolutely.
Right.
It's
We're
a
their
really-
family, they're our family, and it's and then they graduate, when they heal.
Yeah.
And we get like all emotional.
Right.
I know.
'Cause it is an
To
emotional
let 'em
process.
go. It is. You get attached to everyone.
You do,
Yeah.
and you go through something so traumatic with
Yeah.
That's
people
right.
around. You're bound to have those connections, and you see a lot of stories. I know my family members that have had cancer, that have went into radiation. They've even met people, but it's a very uncomfortable situation. You don't want to talk about it. You don't want to be there. When you're going into these chambers, it's all about your comfort.
Yeah.
And the whole facility. That's what I wanted to say.
Absolutely. Yep.
It is very comfortable when you walk in. No white coat syndrome whatsoever. At all.
Right.
It's
well,
very comfortable.
I think, we try to be, and I've always said this for years since I've been in the business, warm and fuzzy. You have to be warm and fuzzy, because if you're not warm and fuzzy, nobody's going to want to come back.
We
Right.
totally use that word all the time, warm and fuzzy. It's true.
It's such an old term, but it's so relatable. And people that use that in the medical world are bound to be more successful.
Right.
Because
It's
people
true.
are so scared. I would be so
Yes.
scared. The worst thing is accepting that you have a wound.
Yes.
Small, little, small, big, whatever it may be. But to have that support is warm and fuzzy.
Yeah.
Yeah.
You have to allay everyone's fears. Anxiety. You spoke about claustrophobia. Anxiety is really high with our patients,
Right.
and we just really try to calm them down and take our time with them. So we don't double book our appointments. That's number
Right.
one.
Okay,
we
that's
do not
amazing.
do that. So everyone has specialized time with whatever practitioner they're seeing that day. So that's really good. And as far we spoke about claustrophobia,
Mm-hmm.
you said you would be claustrophobic. The chambers are huge. They are completely acrylic. You can
Completely
see
clear.
out everywhere. It's hard shell chambers, which is what the insurance wants you to have, not those other ones that are soft and you can just peek through and see someone. The soft chambers,
Yeah,
that's no
they're
good.
completely clear.
Yes, so you can watch the TV, and we do recommend that you take a little something if your doctor prescribes it, lorazepam, whatever it is you need, a Benadryl, whatever, before you come. Of course, get someone to drive you home so you're not sleepy, but most patients do very well even if they're claustrophobic. So we try to
Absolutely.
decrease your anxiety, and then the technicians are always there in the room with you, never leave you alone.
They never
You-
leave you alone.
Yes, you can talk to them. They can hear you. They can address your concerns. Yes.
Because that's another. Oh,
most
sorry.
most claustrophobic patients, they'll say I'm claustrophobic, and after they may take a Xanax or a Valium or something the first couple of times, and by the third day they don't have to take it anymore. They
Yeah.
realize, it's not so bad.
Well, that's just like everything. You get your foot a little wet, and then you're not afraid.
Yeah,
You know?
exactly.
And
Sure.
especially with the
Yeah.
technician in the room, that would be one of my concerns because
We never leave you. You're never alone.
that's amazing.
Yeah.
I think that that's a common thing. You sit there and you lay down and you're like, oh, my foot's tingling. This is happening.
No.
You make things up in your mind
Yeah,
because of your
that's true.
fears.
It's
Yeah.
true.
But to have the technician there, no, Jackie, lay down. Jackie, stop talking. Jackie, do you want more
You can
Benadryl?
even have a conversation with the technician, and get to be friendly and take
Yeah.
your mind off of the entire time you're there.
That's amazing.
Yeah.
And they become like your therapist.
I guess so, right?
Totally
Yeah.
two in
Heard
one.
some
Just to have a
stories.
friend.
Yeah.
Well, of course, call in at 888-565-1470. Leave us a comment on Facebook. Guys, we're here for another 20 minutes. If you have any questions, of course, let us know. We'll be right back.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects. Provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
Sure.
Welcome back to Elite Home Health. I am here with Region Quest with Denise Coelho, Hope Fine, and Zachary from Elite Home Health. I want to talk more about Elite Home Health's transitional care service and how it relates to your company. So, Zach, if you could give us some
for sure.
information.
So a couple of months back, we started implementing a new transitional care service. We're trying to be at the forefront of it. We don't want to just be a part of it. We want it to be something that Elite specializes in, transitional care. And what it is when a patient is in a hospital or a rehabilitation center for therapy or whatever, when they're leaving there and going home, that's the transitional care. When they're leaving an inpatient place and going outpatient to their home, or if they're going to have to travel to and from a place, making sure that everything is taken care of. Now, the benefits on the medical side for doctors and such is to reduce readmissions, increase patient follow-up, right? Communication across the board. But how it's benefiting our patients is when they go home. So when you're in the hospital, it's one thing, right? When you're in a hospital, when you're inpatient, when you are 24/7 medical watched, that's one experience. But then you go home and, it's a whole nother ball game.
You're on your own.
Yeah, you're on your own, right? So the doctor's there taking care of you, and they write, okay, do this, have a good one.
Yeah.
Right? And a lot of one of the biggest issues is readmissions, is the patient goes home and for either it's not properly taken care of once they get home, or they don't necessarily fully understand what it is they're requested to do, or they don't have the resources.
Right.
Right?
That, or then when you put somebody back in their element, they're automatically more comfortable and they think that they can take on more than what they can actually.
Right.
So I think with using the transitional care and your system, especially with the hyperbaric oxygen therapy and the nutritional program, I mean, you're really just maximizing the growth of the patient.
Absolutely.
Right, and we're partnering with Dr. Bernard Garcia. He's our transitional care doctor, so he also has physician assistants, nurse practitioners that work with him. And within the first 24 to 48 hours of a patient leaving a hospital or a rehab, they are seen at home by a doctor, by Dr. Bernard
Wow.
Garcia.
Wow.
So it has great. I think it's reduced our readmissions some. I think like
Significantly.
60-70%.
That's great.
I don't have the exact number. I mean, what the updated numbers are.
Right.
But the point is when they get home, now we have another doctor coming out to your home saying, okay, this is what they said they should do.
Right.
Does that match? Right? Is
Right.
this
Can you do it in
Right.
this environment?
can
That's
you do
amazing,
these things
right.
and is it actually going to benefit you? So then you have a doctor being able to tweak the things that maybe in this environment didn't work. And then, so wound care, right? That's one that ranges a lot in terms of the severity.
Right.
We see a lot of surgery patients,
Yes.
patients that have hip surgeries or knee surgeries, majorly debilitating issues that, again, with the comorbidities, when the patient goes home, it's a whole nother ballgame. It is. There's a lot more struggles to the medical side of things
Right.
when you're on your own. So having a
Absolutely.
doctor there to come out to assess the situation and be able to say, hey, this needs more attention than we can. We can come out and at least initially every day to do wound care.
That's
But
amazing, yeah.
to speed up the process, right? We're trying to we want patients to get back to life. Right? That's the point. This isn't about keeping patients as patients.
Right,
right.
We these are people that have lives to live. So however the goal is the fastest, quickest, smoothest, easiest, nicest recovery possible.
And the best road for the longest recovery. So you're not seeing a recurring issue.
Yeah, not just cutting corners to get you there
No,
quicker.
we're not cutting
Right.
corners.
But also, people have to realize too, and you'll agree with me, I'm sure. There's a difference between wound care and dressing changes.
yes.
Yes.
Because the doctor can order, okay, I want a dressing change, every other day, and somebody, a nurse or somebody, will come into the house, every other day, and they'll look at the wound and they'll say, okay, and they'll just change the dressing.
Yeah.
Well, you have to have a trained person. If that wound is not progressing, if it's not healing, then what do you do? So.
And a lot of patients will go back to the hospital
And they
for
go
that.
back to the hospital. You need somebody who really knows wound care, advanced wound care,
Yep.
to say, you know what, this particular dressing that maybe you got at the hospital is not working now at home. Now we have to
Definitely.
change it to something else.
And, that was something that we talked about on a previous show with Jackie from Elite Home Health. Excuse me. They only take in the trained professionals for that exact reason. You don't want them to stay patients. You don't want these people to go back into the hospital.
Right.
One, for the exhaustion that they're going to suffer from,
Right.
the pain, the everything that's going to happen. And with your guys' treatments, I think that it's just amazing.
Well, I think also the people that work for Elite, they're
Right.
trained enough to know, you know what, this wound is not getting better, so let's
Let me
you know,
reach out
something-
to
let's
a-
reach
to
out
a
to
consultant.
RegenQuest and
Right.
see.
Yeah.
Definitely.
Let's do something different.
Right.
Let's work as a team. Let's do something different now, and try to heal
Definitely.
this
Right.
wound.
And especially with the nutritional program, so many people with this service that they're taking into consideration, the transitional care, if they're not taking medications anymore and they're just solely focusing on the nutritional program, this is really great because they'll be able to monitor, okay, you do want a snack, okay, have this instead of that, and this might be better for now, and it could just all work together.
It can.
That's
And
what I
then-
love
yeah,
about
and
it.
you have the doctor come into your house. In
Yep.
addition to he does the first visit, then he provides tablets. So specifically, at least with our patients,
Okay.
I think he's doing it across the board now too. But when they come in, so
This one was really great.
he's
Yep.
he's speed lined it for Medicare patients to basically make it the best, quickest, nicest experience they can have. If they don't have a tablet or if they don't have a phone that is smartphone
Like a
capabilities,
smartphone,
he provides a tablet for them at least during the
Oh,
duration
wow.
of their service.
Right.
So that they have access because he does telemedicine
Okay.
24/7 basically. I think I haven't seen an appointment not be able to be made, and they're in 15-minute intervals. And
That's great. It's
I've actually
amazing.
sat with a patient, set this up with them. They wanted to see the doctor. 15 minutes later, we were sitting face to face with the doctor on a tablet. So,
And it's so great,
amazing.
especially for wound care, if somebody has a physical injury rather than a neurological one. It's great because you don't have to go in and out of the car. You don't have to be walking. You don't have to be putting strain
Right.
on that injury.
that's
Right.
a part of it, because we'll have a patient with a wound or say a scratch, say something happens, and it's not emergency level. Obviously,
Right.
emergency, 911,
Right,
hospital,
right.
go. But there's an issue or a scratch, something. They can see the doctor. They don't have to go to anywhere. They can be in their home. Doc, look at this. The doctor
Right.
can write a script or write, you need advanced wound care. Boom. Go
Definitely.
to Region Quest, or you need this
Right.
from your couch, and
Right,
then you're
right.
set to go.
Right.
And in addition to that, sometimes you go to the doctor's office and it's not as bad as it was. So I think that with the phone calls, that when you can just call up and you can just show them, and that's how it is. You're not wrapping it up. You're not preventing anything
You're
from
not
getting
sitting
any worse.
in a
You're not
crowded
sitting in it.
doctor's office
Yeah.
And increasing anxiety after
Absolutely.
with
hospitalization.
everybody coughing during flu season.
It feels like flu season will never leave either.
I know, it's almost over. But along that note, Region Quest is also separating itself from all of our competition, because we do have an ALF program where we will go out to an assisted living facility and we will do consultations for wound care.
Wow.
And then myself usually, and then I call Elite, and Elite nurses take over and do the wound care all of the other days of the week, and I just see them once a week. So they don't have to come to this clinic at all. That we can see them on site.
Yeah, and Denise can't be in like 70 places at once, so she can go to the
Give her a little
ALS.
bit of a break,
Yes,
guys.
I'll rely on Zach and his team at Elite. So yeah.
Well, and that's just something that I was going to ask you to clear up the show. What makes you stand out? But I don't even have to, because you're all working together. So it's always two is better than one. And the more resources, the better. Because the patient's always going to feel like they have somebody if they are alone. And you see a lot of people coming down here, a lot of the elderly community, and for example, my grandparents, my grandmother will not accept that she's getting older. She is a powerhouse. But my grandfather fell last year and was in a rehabilitation center. Something like this would have been amazing.
It would have
because then it puts strain on his partner and it puts strain on the family.
That's right.
And to alleviate the pain of the patient and the patient's loved ones, you guys are doing it all. And of course, you can't be in 70 places at once. So let's not take advantage of her. But she will totally be there if you need her.
Absolutely.
Like you said, you guys just become such a family with your patients because you care. And
And they know it.
they know it, right? Because you prove it. It's not just empty words, Your actions are speaking so much louder than words. And when I first moved down here, I always had this stigma on healthcare being in and out and no one really cares, and it is what it is, and I'm just going to have to try to live my best healthy life as is. But it's not the case anymore. And I think that it's something so important for people of my parents' generation and their parents' generation to learn to accept, because the way that it was isn't the way that it's always going to be.
Right.
And this is why I love doing the show. You bring on these people like yourselves that just are so trained and are so in love with what they do. It makes work not work.
It's not work.
You know?
And when you have a great team, and then when within the company, within the clinic, and then you have great people like Zach
Right.
and who, Jackie and whoever else is there on his team, it makes a difference. And the nurses who call us, no question, nothing is ever dumb. Any concern you have, anything like that. So it's great to work with those nurses.
I was gonna say, because I felt, or I understand the fear of the, it is such a quick shift medical, right? And there are a lot of places that are, but we take pride in partnering with places that are not like that.
Right.
When we find a good one, stick with them.
Right.
Yeah.
And the issue is not a lot of people know.
Well,
That-
that's,
a lot-
what?
they
If
don't
you're
know where the
watching
good
this
ones-
show, share it out, because like he just said, not a lot of people know. I wouldn't have known, So let your family, loved ones, friends know you're watching this show. So share. You can help somebody. Seriously, though, it's so incredible. Just the people that I've met with Elite Home Health, I've never felt that they were ingenuine. You know how you could pick
That's
up
great.
sometimes how somebody can be a little, yeah, it's okay. We're just going to give the information. It was never like that. And you ladies are amazing as well. I think that everybody who's watching this show can benefit from your hyperbaric oxygen therapy one way or another. Your loved ones, your friends, yourself.
Yeah.
And you don't have to be an athlete to come to our
Right.
chambers. You can be a little kid in hockey
Yeah.
who got hit in the head and passed out, or
I think that's one of the hopefully from the show, this kind of at least whoever's listening, whoever's watching, a little bit of education, because I think this is one of the most underused in terms of the medical field.
It's true.
It's one of the most
Underutilized.
Yes.
underutilized areas in the medical field that actually has real benefit.
Right.
And I think part of the reason is because there is not a ton of medical research to back it up yet, because it is underutilized. The area that's seen the most actual statistics, doing my research again, was the diabetics. Right, there was a
Okay,
60%
interesting.
across the randomized. Not trying to skewer the results to benefit, right? Randomized selection, but across the people that did and did not have the hyperbaric oxygen therapy for diabetic patients, there was a 60% improvement in at least specifically wound care. And
That's so amazing.
as more people utilize it, more knowledge, more information will be
Right.
given out. But
For now, you got to just go see for yourself.
yeah, exactly.
You have to just go see for yourself. Trust the process.
Come visit us.
Come visit them at 1898 West Hillsborough Boulevard in Deerfield Beach, right by Boca Raton, 33442. And where can I reach you, lovely ladies? What's your number?
We're there, 954-571-9392.
It's easy as that. And you guys are open from 8 to 4:30. Of course, the hours are flexible depending on the patient, because you are all about the patient and you're all about the
All
patient's
about the
care.
patient.
That's
Come make
right.
friends, come make family, come have a second home.
Yeah, right.
I'm just going to wrap it up with a quick story. I was training for a half marathon. I twisted my ankle. If I would have known about this,
You could have come.
this is why I love doing this show. When I met the eye care VP, Dr. Bravo, I was like, oh my gosh, this is it. This is my new doctor. You ladies are my new home.
Dr. Bravo is great. Whoever
Yeah.
he's infectious, you guys would love him.
Yeah.
But that's the great thing about Elite Home Health. Thank you again for coming onto the show and supporting Elite Home Health.
Thanks
Thank
for having
you
us.
for
It's
having
the-
us. Thank you, Zach. Thank you
course.
to Elite for having us as well.
It's
to
just the
have
whole thing. It's the whole practice with Elite. It's the best care, education, communication, and not trying to outwin each other.
That's right.
And again, if you
Not
do
a
have a real
competition.
emergency, obviously come into the office. But of course, call 911 first, get it looked at, get yourself security, and just feel good. Quality of life. You're in South Florida. People come here for paradise. Live it up.
Exactly. Yeah.
I can't wait for not next week, the following week's next show. And stay tuned, because we are going to be bringing you new medical professionals every other Monday. So we'll see you next week, guys. Thank you.
Thank you.
Thank you.
Cool.
Nice.
Thank you for listening to the Elite Home Healthcare Show. Elite Home Healthcare delivers care to you or your loved one in the familiar comfort of your own home. Medicare pays 100% of the costs with no copayment and no deductible for qualified homebound patients. Elite Home Health Services will develop an individualized plan of care to meet your specific needs. Skilled registered nurses and physical therapists will plan and implement your care, along with your participation and your doctor's guidance, assuring a plan specific to your needs. We'll make multiple visits to your home over weeks or months to make sure you are recovering according to plan. For more information, call us 888-422-3578. Join us for more information and news on our next show.
Dr. Lee of Boca Raton Acupuncture Clinic with a PhD in neuroscience